A team of local dental providers is offering dental house calls to those living in senior care facilities. It's a way of providing all-important dental care to patients who have trouble getting to a dentist. We learn more about this program as part of our monthly AARP-sponsored segment that highlights issues important to older adults. Joining us now is Dr. Davis Henning with Coronado Dental, which provides the mobile dental care service. Good to see you here. Thanks for joining us.
Thank you for having me.
Dental house calls for seniors. What are we talking about here?
We're talking about bringing the care to the facility. We're talking about patients that don't have access to care to get to a traditional dental practice. A lot of the times we see the fall off once we enter into the long-term care setting where they no longer return to their private practices that they've been going to or may not have been going to. And once they arrive, they tend to get enrolled in benefits, Medicare, Medicaid, that for some may be their first chance to access dental care in a while, and for others, they need somebody to come see them because they haven't been able to return. So for us, we bring it to them.
Yeah. So as far as the dental services provided, first of all, how does it work? I mean, do you roll stuff in there? I mean, I've seen a dentist office. There's a lot of stuff going on there.
Yeah. A lot of people picture the van, a big mobile van.
Yes.
There's a lot of challenges with that and trying to remove a patient from the setting in the long-term care space, bring them in from a hospital bed, transfer issues, getting them outside of the protection and all the staff and medical people that are there. We go to the bedside. We do roll things in. It's buckets, stackables that are specialized to what the care is, and technology's come a long way and being able to do it. So we're using digital sensors with it looks like cameras that are taking the radiographs. We're connected to Wi-Fi through MiFi mobile jetpacks, and all of it's on cloud-based EHR.
So when you say radiograph, is that a fancy way of saying X-rays?
An X-ray, that's it.
Yeah. So you can do it right there, bedside.
Exactly.
And if a cavity is found, or if a root canal, goodness gracious, a root canal, God forbid, be found, do you do that there, or do they have to go to a special place for that?
So we try to do as much as we can on site. We're really trying to eliminate the issues with the transport and the tediousness of that. There's a lot of medical things that can get in the way. There's logistical issues. There's transport issues. Trying to do everything that we can on site. Yes. What can we do on site? Just about anything that you can do in a practice. Yes.
Isn't that interesting? And you can also provide, I would imagine, a personal plan. I mean, you get to know these folks. They're not going anywhere. I mean, you know where they are, you know where to find them, and if they need the help, you can go get them, I guess.
That's it. So I think the biggest challenge is when you're trying to let people know about this service, let them know that we're here for them, making it aware that when you onboard into a facility that you should be seen by a dentist. The providers are here, we're across the whole valley, we're down in Tucson, and we want to take care of your needs, not just when there's an emergency, not just when you need the filling or need the root canal, but preventively, and trying to mitigate the risks of major incidences occurring, which can lead to pain, infection, antibiotic use, hospitalization. So I say affectionately, we're not here to do Scottsdale dentistry, full mouth rehab. We are here to come and take care of patients. I think what is the heart of dentistry, eliminating pain, infection, trying to restore function, and number one above all else is patient dignity. And it's just a matter of getting the word out, letting people know that we're here, we will come see you. We're in assisted living, memory care, the long-term care space with skilled and the long-term components.
Yes.
And the benefits are starting to improve. Arizona's always had a great benefit structure with Medicaid. Mm-hmm. And there's a good bit that we can get done through these different programs. Medicare Advantage plans are actually becoming quite competitive and are providing great access to care. So,
I was going to ask you about insurance, how the insurance plays into all this.
Exactly, yeah.
Last question here is how many visits can you do a day, A? And B, I mean, at a dental office, you got your day. So is it the same kind of thing on the road, or can you just slip some? I mean, you find out that so down the hall needs some help. Can you just go down the hall and help them without an appointment? How does that work?
Well, if they're a patient of record, sure.
Yes.
I'm happy to pop in. If there's not, there's definitely a little more bureaucracy involved in trying to navigate the different patient representatives, the power of attorneys, responsible parties, and there's a process for that. my goal is that nobody's in pain or hurting. And so
Yes.
if we find out that that's happening, our team is expediting that and we're getting it in. As far as the schedule compared to a regular dental practice, it's fairly similar. I think there's certain procedures that do take longer to set up, but we have a good feel for what we can and can't do throughout the day, and different days, depending on the procedures, will vary. But it's the primary nature of this is to eliminate pain, infection, and major problems. So dental emergencies are a huge part of what we do, and we always have space to try to get in. Between the 3 docs that are patrolling essentially the valley, we're able to get out within 48 hours.
Well, it must be very rewarding. Congratulations on your success, continued success. Doctor, thank you so much for joining us. We
Thank
appreciate
you.
it.